Sclerotherapy is a means of reducing fine blood vessels on the legs. Now this is pretty much exclusively a lady's problem, and it's either a family history or after pregnancy, or if you've had a job that involves a lot of standing or sitting. And they're these unsightly vessels that we have mainly on the lower parts of the legs and on the thighs. Sclerotherapy involves injecting a chemical which irritates the lining of the blood vessels and makes them inflamed and makes them clot and clog up. Then over a period of a few weeks, the body then absorbs those very fine vessels, and it can be used on a number of different size vessels on the legs, but it can't be used very successfully for varicose veins. We have several nurses in our clinics who are expert at doing this. They use a particular type of lens that magnifies the blood vessels so they can see these tiny little vessels and manage to put a really fine needle into the blood vessel. And then they inject the sclerosant, the chemical. And you can see pretty much instantly that it's going to work because the blood vessels blanch. The discomfort as far as the patients are concerned are having a fine needle put in under the skin. Usually a session would last 30 to 45 minutes, something like that, and the patients walk out. There are some restrictions after the treatment. We like for them to wear support tights, not to have very hot baths or hot showers or go in jacuzzis for a few days afterwards. So anything that encourages the circulation, we try to reduce that in those first few days whilst the healing process is going on. The healing process in total is about 2 weeks in duration. We expect bruises, a bit of blotchiness and a few marks, and they pretty much disappear. The side effects relating to sclerotherapy are small, inexpert hands, but the most important one is ulceration. And this is where some of the chemical leaks out into the skin and can cause damage in the skin and end up forming a little mark. It's very uncommon, but it can happen. Blood vessels on the legs treated by sclerotherapy should be permanent, but if this is a genetic predisposition, you're likely to develop more as time goes on. If you continue to be a hairdresser and stand on your feet all day, you're likely to develop more as time goes on. So for those type of people, it will be more of a maintenance treatment. So we maybe have 2 or 3 sessions to get to as good a position as we can, and they might come back once every 2 or 3 years and have a single session to pick up newly formed vessels. The cost of sclerotherapy is £150 to £170 per session, and you would require 2 to 3 sessions on average.